final presenter.
Thank you, Alicia. Yes, I have been with DAPS since 2019, and I'm thrilled that I was the board president of our organization for the last year. And I cannot tell you how much we appreciate your attendance today. This just reaffirms our faith that DAPS is doing the right thing for the PD community and giving you information and bringing a sense of community to you. So at the end of our afternoon today, I encourage you to go by and pick up one of the brochures from the Dallas Area Parkinson's Society. It has our contact information. If you are not receiving emails or if you would like to be connected to our newsletter, just become connected. Just become part of our community. And so I encourage you to go by and get one of our pamphlets for your information. And with that, I'm pleased to introduce to you, I just met him earlier today. His name is Dr. Bradley McDaniels. He's the assistant professor at the University of North Texas, and he is the coordinator for the Rehabilitation Studies program. His research focuses on the neuropsychiatric manifestations of Parkinson's disease with a particular interest in apathy and the challenges of loneliness and social isolation. He hopes to validate interventions that can improve the quality of our life and change the disease trajectory. He has recently returned from Spain, where he presented a study with the Parkinson's and Movement Disorder Alliance. So please help me welcome Dr. McDaniels. Thank you.
Thank you for the kind introduction, and I'm excited to be here with you guys. You know, anytime I get a chance to talk about these things, it's fun. And I don't know if this is the apathetic or the non-apathetic crowd that's here. You're either motivated to stay or unmotivated to leave. So I'm not sure which way this goes, but we'll roll with that. So a little bit about the objectives. Most of you probably realize that apathy is an issue with PD. All right, so we're going to talk a little bit about that, help you to understand what it is and the challenges associated with it. What role does meaning in life play? Right, it's been an interest of mine. As we go, I'll kind of explain my thinking with how I attach these two things together. And lastly, it's no good to be able to identify a problem if we can't also give you a solution to the problem, right? So hopefully we'll get to do that along the way. I'm going to share with you a little bit about me. I spent 18 years in the pharmaceutical industry, from a rep into regional director for a biotech company. And almost 11 years ago, 10 plus years ago, my mom was diagnosed with Parkinson's. And I went back to graduate school. Said I want to do something to make a difference in her life. And at 42-ish at that time, I said I'm too old for medical school. Neurology takes too long. And I thought PhD was the next reasonable option. And so I did that, University of Kentucky. And quality of life has, for many, many years, been a focus of mine. How can we make life better for people with PD while we wait for a cure? I was talking with Dan at lunch. A cure is one of those things that I avoid talking about simply because nobody has any idea what we're doing with the research on Parkinson's right now. So let's find some things we can do today to make your life better. Makes sense, right? And as the introduction said, my focus is on the neuropsych issues. Apathy, loneliness, meaning in life, positive psychology, resilience, post-traumatic growth, how going through a traumatic experience in your life, once you get through that, can actually mean improved life after. And there's a lot of literature that supports that. So look, that's a little bit about me. I guess I wanted to qualify myself. I'm not just some guy that comes here trying to get a bunch of surveys done so that I can have my name in lights and say I'm a great Parkinson's researcher, because it's really not about me. It's about how can we make things better for you all. So let's talk about a few definitions. Positive psychology is what makes optimal functioning in humans, right? And it's anything that we do in life that makes us function better, right? That's really a short answer to what positive psychology is. What makes life worth living, right? Beatrice Wright was a famous American rehabilitation psychologist, and she was far ahead of her time back in the 60s when she did most of her writing. And she had a couple of areas, enlarging one's scope of values, right? So when something happens in life, a diagnosis of a chronic, incurable condition, we lose things. There are things that we once loved that maybe we can't do the same way anymore. But can we take that excitement, that interest in things, and move them into something else so that we maintain our quality of life? It's a fascinating idea, and there's a lot of research around that. The other one is positive coping versus succumbing, which really just means I'm going to deal with this issue versus giving up. Because you have a choice, right? You can either fight it, you can either find things to help you cope, help you manage your life, manage your disease, or you can say, you know what, this is the hand I was dealt. There's no cure, so I'm just going to hang out and just let it get worse until the end. That's the positive psychology. How can we flourish despite setbacks? Quality of life is a really interesting construct because in reality, quality of life is really me just asking you, do you think you have a good quality of life? That's what matters, not what I can measure with some survey. I can do a survey and I can measure and I can give you a number and say your quality of life is better than 80% of everybody else's in the room. What matters is what you think. So those are a couple of things that you're going to see talked about as we go through this. So now we're going to shift a little bit into PD, and the challenge is right at diagnosis. One of the main challenges, right? You walk in to see a movement disorder specialist. You've probably seen your primary care doc, and they've said, yeah, you know, you've got a slight tremor, or you're shuffling when you walk, or your steps aren't long enough, and there could be something going on. I'm going to send you to see Dr. So-and-so. So you may have an idea that there's something going on, but you walk in and you get I think you have Parkinson's disease, right? You did all the tests, right? Everything that you do. They tell you that. What are your thoughts? Now what? Geez, I never thought this was going to happen. Whether it's someone who's 36 years old or whether it's somebody who's 65. Dramatic change in your life, right? Everything I know is over in my life. These are thoughts that might go through your head. What about my work? What if you're 38 years old and you still have a career? Maybe you work in construction, you're diagnosed young onset, and it's not safe for you to be up on a ladder on a second-story building. Now what? What about your relationships? Family role. You're the primary breadwinner in your family. Now you have Parkinson's disease, you can't do your job, who's going to pay the bills? Real life questions, social functioning, right? The fear that's associated with, especially early on in Parkinson's, with a tremor that I go out and I'm setting in a social function and my hand's tremulous, right? The stigma that's associated with that. Real issues. Research indicates traumatic life events may result in changes to one's meaning. Frequently, our meaning is tied up in what we do. If we're a spouse, it may be tied into the relationship that we have with that individual. My meaning was taking care of that person. I can't do that anymore, right? So you hear those things, those thoughts go through your mind as you hear that diagnosis. Reactive depression, right? Frequently you go immediately into a real depression. That's as a result of what you just heard. Anxiety, right? The heck am I going to do now? This wasn't part of the plan. Uncertainty. How long am I going to live? What's the progression of this disease? We heard earlier that Parkinson's is very heterogeneous, right? The way it happens for one person is not necessarily the way it happens for the next. You ask someone, what can I expect from this diagnosis? The expectation is it will progress. Next year, I don't know. 5 years, maybe. Who knows, right? Anger, possible. Angry that this happened. Apathy. Just give up. No motivation to do anything. experiential avoidance. I added that one in there because I think it's an interesting concept to think that I have this tremor, I have this gait issue, and I don't want to go out in public and be around other people who might judge me because of that. So I stay home. Very similar to what happens with apathy. The motivation is just different, but the outcome looks the same. So what do we do with this stuff? This is a lot of stuff, and those of you who have been diagnosed with PD, I promise you've had some of these, may still have them to this day, right? So apathy is the main thing that I talk about. Apathy, I'm interested in it because there is no solution yet. They try everything, SSRIs, SNRIs, cholinesterase inhibitors, dopamine, right? All of these things doctors are throwing at apathy. Sometimes it works, sometimes it doesn't, but there's really no data saying what works. So it's a common neuropsychiatric syndrome. The numbers are about 40% if you look at the aggregate. I gave a range of 13 to 70, which is pretty realistic. So it's up there with depression and anxiety as some of the most common issues. It's really a lack of motivation and goal-directed behavior. I just don't feel like doing it. Doctor says you need to exercise. I know. I just don't, right? It's a real problem. It's a real problem. No consistent treatment, I talked about that. Among the most common factors negatively affecting health-related quality of life in PD. Top 5 or 6 issues that you'll see. You know, many of you have heard that, we know PD is a motor disease, right? But it's a lot of the non-motor stuff that causes the issues, the neuropsych things, that cause the quality of life issues. You can typically treat a tremor, right? There are meds you can use to treat that. But some of these neuropsych things you just can't treat. So what do we do with it? So I'm a big fan of a guy named Viktor Frankl. He is an Austrian psychiatrist, and he was in a concentration camp back in World War I, and lost his whole family. They all died, except for him. And while he was in these camps, he switched around from Auschwitz, and I can't remember the other one off the top of my head, but while he was in there, he began to have these ideas. What is it that makes someone live versus someone who dies? You all have the same food. You all get treated the same way. He came to the conclusion that it's an attitude, that it's having a purpose to look forward to when you get out that makes all the difference in the world. That led to his therapy that he calls logotherapy, which is the therapy of meaning, and it's still very common in the counseling world. These are some quotes that are fascinating from him. When you're no longer able to change your situation, we are challenged to change ourselves. You can't change your PD, right? You've got it, and you've got it. It's about changing your mindset. Those who have a why to live for can handle any how. You have a purpose. You have something to look forward to. You can deal with the struggle because your eyes are focused out here. You're not focused on the minutia of what's going on right now. In some ways, suffering ceases to be suffering at the moment one finds meaning. Meaning changes everything because your eyes get off of your problem and go to your meaning. We're not focused on what's going on. And lastly, striving to find meaning in one's life is the primary motivational force in man. That's a pretty powerful statement, right? I knew nothing about meaning in life until I read his book, 8, 9 years ago. And it changed my life. And I wholeheartedly agree with this stuff. Is meaning in life something that's talked about a lot, that's researched a lot? I just did a Google Scholar search about a week ago. 5.9 million hits for quality of life. That's a fair amount. 4.5 for meaning in life. There are less hits about depression than there are meaning in life. I would have never guessed that. I would have thought depression was a lot more common. Not even 1 million for Parkinson's disease. Very common, very researched area. And the research has grown in the last decade tenfold. Before 10 years ago, there wasn't a lot. But there are some researchers around the country that have done tremendous work in this area. So it's important, I think, that we define what this is that we're talking about. I'm talking about meaning in life, not the meaning of life. Two very different constructs. Meaning of life is kind of this esoteric thing. Why are we here? Why are humans on the earth? Right? You could sit down and have a beer with a friend and talk about that concept. And is there an answer to that? I don't know. But from a research perspective, I don't like that because I can't measure that. I can't measure meaning of life. I can measure your meaning in life. And the meaning in life is what you define it as. What gives your life some purpose? What gives you significance in your life? Traumatic events may result in changes to one's meaning in life. We talked about that. A clear sense of meaning and purpose can add something positive and result in great things in health outcomes. So it's important that we understand meaning in life is a big deal. I skipped the domain level. We can have meaning in different areas, and if you look at the meaning literature and you look at a meta-analysis of all of it, there are a few areas that are critically important to meaning in life. Spirituality, relationships, and work. Those are the top three in almost every study that's been done. Ask somebody about their meaning in life, and it's going to usually fall into one of those three categories, right? We'll talk a little bit more about why that matters in a few minutes. So how do we define meaning in life? How do I measure it from a research perspective? The newest research now has said that it's a tripartite model. There are three components to it. The first one is significance. Extent that my life matters. I have inherent value. My life is worth it. Do you feel that about yourself? It's one of the three things that you need to have to be able to say, my life has meaning. Coherence. Does your life make sense in the broader view of how you view the world, how you view things happen? Does it kind of just make sense that you fit in? You're the puzzle piece that fits into this part. The last one is purpose. Meaning and purpose are frequently used interchangeably. Viktor Frankl had words that differentiated those two. So I would always default to him. You can look at literature today and you'll see guys that publish and they say they're the same thing, or purpose is the higher order over meaning. I kind of go back to Frankl because he's the guy who coined all of this stuff. And he says there's a difference. And so does your life have purpose? Is there some highly valued goal out in front of you that you want to reach? It's essential. Think about it in your own lives. What is that thing that you're shooting for, right? I don't know what it is, but it's important to consider. So if I was going to do a study and I was going to measure meaning in life, I would use a survey instrument that measures these three things. And there are two different ones now that are validated, that are very good and used regularly. So I always think it's important to talk about, so what if I have more meaning in life? What difference does it make? It might help apathy. That's great. There's a lot more to it than that. People who have higher meaning in life, this is all literature-based. I didn't put all the citations in there, but this is all stuff that's been published in peer-reviewed literature. People who have higher meaning in life have more positive emotions, happiness, joy, peace, right? Have better personality traits, have more life satisfaction. They report a better quality of life than people who have low meaning. They think their life is pretty good. Self-esteem, self-worth, right? You'll see that this makes sense if you think about it, right? Positive coping. Adaptive versus maladaptive coping. Do your coping mechanisms make sense? Many people cope with substances. It's largely maladaptive coping, right? It might work for a minute, but eventually it doesn't work anymore, right? It works till it doesn't. Have more hope. Hope for a better future. Hope that things will get better. There are things out there that are going to come in the course of my disease that are going to be good. Optimism, same type of thing. Positive outlook. Resilience. Resilience is another area that I research, and it's fascinating. Resilience is when something traumatic happens in your life and you kind of slip back a little bit. You begin to fall into this place of some depression, some anxiety. I'm struggling. My functioning isn't as good as it once was. People who are resilient bounce back. They get back to where they were before, and they move on. The literature says the more times in your life you experience events that force you to bounce back, the easier it becomes over time. Right? So people who have been through a lot in life and have seen themselves through it are typically highly resilient individuals, and they're much better able to handle stressful situations that come, and they just don't get down like others. And that's different from post-traumatic growth. Post-traumatic growth, resilience brings you back to baseline, where you were before the incident happened. Post-traumatic growth says you're better than you ever were before. And that's not uncommon in chronic illness and disability. There are many people I've met who have experienced an adventitious disability, something that happens in their lives. It's a setback. They work through it. They get to a place, and they've had new experiences that they never would have experienced without that setback. And there are many that I talk to who say, I wouldn't go back if I could. I've got a good friend of mine who lost his sight, and he's lost a leg in an accident. And it's been 5.5 years. He said, Brad, I've had more experiences like this than I ever would have had. I've met more people. I've impacted other people's lives in a way that I never could have before. That's post-traumatic growth. It's a different place. Health-related quality of life, we talked about that. Well-being, successful aging. You want some more? Meaning in life is associated with less physical decline, slower cognitive decline in older adults. This is looking at dementia patients in particular. Pretty impressive, right? Fits into Parkinson's disease. I believe there's a little cognitive component to Parkinson's disease, right? So I would pay attention to that. Less PTSD, less hypertension, less negative affect, right? Just feeling down, the blues, feeling in the dump. Less depression, clinical depression, less anxiety, less suicidal ideation, less substance abuse, less need for therapy. I mean, we could really stop right there, right? All the positives and all the things that it prevents. I mean, I want that pill. Whatever pill I take to get me all of that stuff, I'm in, right? And it's as easy as finding meaning in life. It's really not that hard to do. Last one. This is the impressive one. People who had higher meaning in life had lower rates of mortality. This was done by a researcher named Patricia Boyle. I think it was 2009, so it's been a little while since she did this. They controlled for all co-occurring morbidities, any other illnesses that you had, obesity, high blood pressure, all of that. They controlled for it all, looked at people 65 years and older over a 5-year span. Those who had higher meaning in life had an 11% decreased chance of mortality at 5 years. It's impressive. 11% decreased mortality, just because they reported higher meaning in life. Why is that? Well, look at the list before. You don't have all this stuff. What are the things that cause people to die? Hypertension, right? Depression, suicidal ideation, right? The list before, all of these positive things. We know the associations between hope and optimism and outcomes. Very solid. People who have more optimism, who have more hope in their life, have better health outcomes in general. So it all makes sense. So, what about people in PD? Right? This is the general population. Some of it was done in people with dementia. Some of it was done in older adults in particular. So, some colleagues of mine and I, we did a study and we said, all right, let's look at meaning in life and apathy in people with PD. Let's see if we can find a correlation between those two. People with higher meaning in life have lower apathy when controlling for all other variables in PD. It holds true. Same with people in PD as it is with other groups. So it's the first study that's looked at this relationship, and it's getting ready to be published. I just got the proofs yesterday, and so it'll be out probably in the next 30 days. It's pretty exciting stuff, because now we get to move to the next stage where we say, can we develop an intervention that's going to make a difference in this? Because at the end of the day, that's what matters in research, right? I was just talking to a friend at lunch, and it's great that we can identify these things that are problematic, but if you can't change them, I'm not so sure I want to know. If you told me today that I'm going to have Parkinson's disease in 20 years, but there's nothing you can do to help me prevent that or make that any easier, I'm not sure I want to know, right? So that's where, in my mind, that's where the research comes in. What can we do to make a difference in people's lives, right? Oh, wrong way. So, there's been a variety of articles published on looking at meaning in life, and there are several clinical interventions, cognitive behavioral therapy, meaning-based therapy interventions that are very effective for helping someone find meaning in life. A couple of challenges to those. Think this through with me. You're apathetic, and your doctor says, I want you to go to therapy. I don't feel like it, right? You're not motivated to go. You're just not going to go. We run into the same problem with depression. If you go get CBT therapy, we can help your depression. I don't feel like going. Right? Depression and apathy have a lot of common overlap. They look very similar. If I talked to you clinically and you told me your symptoms, I would probably have a difficult time differentiating whether it was apathy or depression. Because a lot of the time it's feeling down, I just don't want to leave the house. Just going to stay right here. I don't have any motivation to get up and do anything. It'll be okay, right? So aside from the clinical interventions that we know work, that are costly, that people aren't probably going to attend, it takes 10 to 12 sessions at least, weekly sessions, to be able to see an outcome with those types of interventions. What else can we do? So, the literature supports looking at these areas of life. Your relation, right? We talked about the top three: relationships, spirituality, and work. Those are the areas that most people find meaning in their life. So let's look at those areas. How are your relationships? What are they? Right? I was talking to somebody earlier today about this event here. How'd you think it went, Brad? And I said, thought it was good, but I'm much less concerned with the content than I am with the connections that are made inside this room. Literature is really clear on loneliness too. That what happens when people connect is amazing. It's exponential versus what happens when you try to do things by yourself. It's good for depression, it's good for anxiety, it's good for apathy, it's good for all of these things. So that's the other piece. Religion and spirituality, if that's part of your life, make it more a part of your life. If you're struggling with meaning. Work. You still work. Work doesn't have to be paid employment. I told you all earlier, my mom was diagnosed with PD. She now volunteers at it's kind of a homeless shelter that people donate clothes and then they sell them at a very cheap price to people in the community who can't afford them. And it's the highlight of her week. She doesn't get paid. She goes there and she spends 8 hours. I call her every day. On a Tuesday, I call her and she goes, I'm at work. Can't talk. Like, you're not at work. You can talk whenever you want to. It's volunteer. But it's what makes a difference in her life. Being around people, doing something altruistic that's outside of you. One of the great ways to find meaning. Health. Focus on your health. Exercise. Helping other people exercise. Nature. I just enjoy going for walks in nature. Do more of it. Right? Maybe you meditate while you walk. Meditation's a great thing to do. The literature on meditation is very clear too, for hypertension, depression, and anxiety. Very easy to do. Get education. Maybe it doesn't have to be formal education. You just take a class. Learn something new. Something that you just learn for fun because you enjoy it. Get involved in the community. Support groups, exercise groups, PT, OT, all the people that do that. Go out to lunch afterwards, right? Do things to connect with other people that are fun. It helps. Hobbies. Find something you enjoy. We saw that the young man earlier that did all the origami, right? He teaches people how to do that. If it looks interesting to you, learn. Figure it out. Maybe that's your part of what makes your life meaningful, is doing something like that that's contributing to the greater good of other people. Something to think about. So according to Frankl, again, I said I defer to him for most questions on meaning. He's got a ton of different books. Some of them aren't in English yet. But we can discover meaning in 3 ways. By creating a work or doing a deed. Going back to that list before. Engaging in something on this list. Doing something. It takes action, right? We don't create meaning just sitting at home on our couch. You got to do something. Experiencing something or encountering someone. This is encountering someone. This is experiencing something, right? Going out to lunch with friends is experiencing something. It's encountering someone. Find a way to do that. Find a way to get involved in a community that's meaningful to you. And lastly, the attitude we take toward unavoidable suffering. Frankl said, someone can take away everything from a man, except he has the ability to choose his attitude in any given situation. The attitude we take towards suffering matters. Other people see it, right? It goes back to Beatrice Wright, coping versus succumbing. What's my attitude? I'm going to fight this, or I'm going to just give up and quit. And it's a choice, right? Every day we wake up and we have that choice. Do I want to have a positive attitude and think, I'm going to conquer today, I'm going to find something new to do in my life that makes it better? Or more importantly, something I can do today that makes someone else's life better, right? That's why people volunteer at organizations like this. Don't think that people who volunteer at things like this don't get something out of it. They all do. It's not money. It's the feeling of a greater good, right? I contributed to something that maybe made a difference in one person's life today. That's a good day. Martin Seligman, I talked about positive psychology at the beginning. He's the father of positive psychology. And it's been about 20 years since, the positive psych movement came out. And it was really a referendum on what we knew about psychology at the time. Psychology for years had been focused on deficits. Let's talk about all of these bad things that you have and figure out how to cure them. Martin Seligman came out and said, what about all of these great things that you have? Maybe you have a little bit of hope in your life. How can I make that greater? Maybe you have a little bit of optimism. How can I enhance that? Rather than looking at the negative, because if I enhance those, these negatives are going to diminish just by virtue of these things getting better. So he says, we, without a doubt, that's just a crazy word. That's the word he used, so I just left it in there. Want meaning and purpose in life. The meaningful life consists of belonging to and serving something that you believe is bigger than the self. And humanity creates all the positive instructions to allow this. Religion, political party, being green, Boy Scouts, family, PD support group, PD exercise group, DAPS, SkyPass Foundation, right? Pick the group, doesn't matter. But that's exactly what he's saying at the end. Get involved. Get involved. Help someone else change their life. And by doing that, your life will change. Try it and see if I'm right. Because the literature is clear. And I've seen it. I've seen it happen in too many people's lives. There are people in this room that I've seen who have been through really tough struggles. And you meet them today and you talk to them today, you don't hear about it. They don't sit down at the table and go, let me tell you how crappy my life is. Man, I had this happen and this happened and this happened and this sucks. And, we all live in the world. We've all got things in our lives that happen, right? I mean, we can sit down and compare bad stories. But nobody wants to hear that. It's fine if you want to share with somebody because you're struggling. That's great. But the difference is the attitude that you can see in someone who has done this flip, who has found meaning despite their circumstances, flourishing despite suffering. That's kind of the new meaning in life 2.0. Guy named Paul Wong up in Toronto, he was probably one of the major influences of meaning in life around the world. And he's kind of taken what Frankl said, and Michael Steger from Colorado State, who's another big name in this field, and he's taken that and said, let's move to the next level. And he's really been talking about this idea of flourishing despite suffering, which really is post-traumatic growth. He's calling it a different word, but that's really what it is. Suffering doesn't mean it's the end of everything. It can be a springboard or the impetus for something great to happen in your life. $1 million question. So what do I do about it? You can say, that sounds good, Brad. That's all great. But what do you want me to do? That's what you do. Right? So we had this list. Think about that list, right? Those are all sources of meaning, common sources of meaning across all meaning studies. How are things going in those areas? Simple question. Just sit down and think about it. Good, bad, indifferent. I don't know. Do more of what you find meaning in. If you find meaning in nature and you love it, do more of it. Right? I mean, that's just common sense. If you enjoy something, you should do more of it. It brings you joy. Engage in these activities with others. How cool is it if you enjoy nature and you've got a friend, a spouse, a colleague, someone else who also enjoys it, and you can go hang out and just be together in nature and talk about it and appreciate it, right? It's fun. Share your experiences. Share the things that you've engaged in that have brought meaning to your life, because it will make a difference to someone else when they hear you share that. It gives them hope, right? You've got PD, someone else has got PD. You found some meaningful experiences. They're down in the dumps. Maybe share what worked for you. And they might go, I should try that. Maybe it'll work for me. Help others foster their meaning. Once you've found yours, help other people find theirs. Ask them the questions, right? How are things going in these areas of your life? What do you love to do? What gives your life purpose? Have those discussions. Practice self-reflection. Spend time thinking about those areas of your life. How am I doing? You start feeling bad, begin to reevaluate. How are those areas? Read inspirational books. Viktor Frankl's Man's Search for Meaning. Highly recommend it if you've never read it. Very powerful book. You'll understand the way that the human mind can overcome suffering. I mean, and I think that I've had suffering in my life till I read Viktor Frankl. I mean, concentration camps in Nazi Germany, right? Crazy. So I hope that you found some things that I mentioned today that made you think. Made you say, I can do that. I want to do that. And there's hope. That's all I've got. Thanks. I'm happy to take questions if you have them. Yes, Gavin.
I was gonna do it with the challenge. Okay, now making it easy. All right. A couple years ago, somewhere online I saw this survey that was being done. They're looking for, I think it was for people with wild PD, young onset, and they wanted people to take the survey. But it was about a 30-minute survey. So I said, well, I'll give it up for the cause and I'll do it. And I took the survey all the way through. And it just blew me away. It was the most in-depth and insightful, informative. What other I words do I got? It was extraordinary, extraordinary. And just taking the survey, knowing someone in research understood what we were going through each and every day and saw us as, human beings and really wanted to get to the root of things that would really help us. These kind of things that no one else is talking about. The doctors aren't talking to us about. but very, very useful. And it's, you know, at that time I'd probably had Parkinson's 12 years or so. And I kind of realized, like, wow, what he's talking about in these questions, really, really impactful stuff no one else is talking about. So anyway, I said, I got to contact this guy. I contacted him. Turns out, you know, of all the places in the world, he's 25, 30 miles from my home in Denton. So we've got together, and, you know, now we sit down and talk and become friends and have these great conversations. It's just really, really such an asset to have someone like that within our community who is like is embedded among us. His mom has Parkinson's. Anyway, I'm going on too long, but like I'm really, really, it's so fortunate to have a guy like this, not only in our community of Parkinson's, but in our local community. And I just want to say thanks for all Brad has done, because he goes above and beyond, way beyond, I'm sure, what he's getting paid for any of this.
Thank you, Gavin. I can give you the UNT president's email address. You could send him that and say, Brad deserves a raise. Thanks, Gavin.
Thank you, Brad, so much. We do have another question. Excellent.
This is more of a comment. I think the statement that I remember most from Viktor Frankl's book is, that which does not kill me makes me stronger.
Yeah.
And it seems to sum up those quotes that you used, and kind of points the way toward making positive growth after trauma.
Definitely. And that's Friedrich Nietzsche, right? That which doesn't kill me makes me stronger. And it's in the same vein as this, for sure. Thank you. All right.
Any other comments or questions? Thank you, Brad. I hope you guys were all inspired by Brad. His story inspires me every day. And I just want to say that when I look out, there are so many of you that I think, wow, you are such an inspiration. From Wanda and Donna and Edna and Gavin and Bill, I look at each one of you and think, you guys are the ones that continue to push us and show us that what we're doing matters, that creating a community for all of us is what it's really about. So thank you for being a part of our community. Thank you for your support, and thank you for being here today. We are so thankful for your participation, and as we said before, we'll be sending out a post survey. We would love your feedback, and we'll be sure to send you those attachments to some of the flyers if you did not get those, and we'll let you know when all the recordings are available on our YouTube channel. So thank you so much, and enjoy the rest of your weekend.